All right. Hi, we're doing amniocentesis as our genetics procedure. I'm Kesa.
I'm Glenda.
I'm Michaela.
So our patient background, she's a 29-year-old female. Her name is Barb E. Dahl. She's in her second trimester of pregnancy, and while she has no prior genetic conditions, she's concerned about her child inheriting familial genetic disorders. Her partner has sickle cell disease, and her maternal aunt has cystic fibrosis. She has consulted with her OBGYN, and they have suggested that she have an amniocentesis to check for genetic abnormalities of the fetus. Reasons for having an amniocentesis there are many. Some of them include a family history of genetic conditions, a previous pregnancy that had where the fetus had genetic condition, the parent of the fetus is 35 years or older, unusual ultrasound findings, or positive results from prenatal screening. The test can detect such genetic conditions as Down syndrome, Klinefelter syndrome, neural tube defects, and sickle cell disease. Though it is most commonly done during the second trimester of pregnancy, it can also be used in the third trimester to check for fetal lung development, uterine infection, and the possibility of RH disorders or incompatibilities.
Okay, so an amniocentesis is a prenatal test done during the second and third trimester. It involves collecting a small sample of amniotic fluid so that doctors can look at the fetal cells. The whole process is guided by ultrasound to help keep everything safe. And then here's just an image that shows what the procedure looks like. It shows the two main things that are used during the procedure: an ultrasound to see the baby and the fluid clearly, and the needle that's used to take the sample. And then it's usually done in a prenatal clinic by an obstetrician. It takes about 15 to 30 minutes, mostly because of the ultrasound setup. Afterwards, the patients are told to rest for 24 hours. Mild cramping and spotting is common, and results are usually back in a few days.
Before starting the procedure, the patient is instructed to lie down and their abdomen is sterilized to prevent introducing pathogens into the amniotic cavity. The OBGYN uses an ultrasound with sterile gel to visualize the fetus, placenta, and umbilical cord. This allows them to visualize the fetal movements and plan a safe trajectory for the needle. The OBGYN should keep the probe perpendicular to the needle to fully visualize the needle's path. After the initial skin puncture, the OBGYN should readjust the needle position to account for patient shifting and mild contractions before puncturing the uterus. The OBGYN should aim to quickly puncture the amniotic sac to prevent tenting, which is the amniotic membrane stretching around the needle instead of breaking through cleanly. Once inside the amniotic cavity, the needle is moved to the maximum vertical pocket, which is the deepest area of amniotic fluid not occupied by the fetus or umbilical cord, so fluid can be drawn safely. Although rare, there are multiple ways that complications can arise. If the needle punctures the intestines, there is a risk of chorioamniotitis, an infection of the amniotic sac. Additionally, there is a risk of maternal sepsis, a potentially fatal bacterial infection of the blood. The placenta shouldn't be punctured since it increases the risk of transmitting infections like hepatitis, HIV, and toxoplasmosis. This procedure also has a 0.11% risk of miscarriage. It also increases risk of preterm labor. If the puncture site leaks fluid, it can cause a leukohydromosis or low amniotic fluid. Rarely, the needle can accidentally puncture the fetus or umbilical cord. Switch a slide. This is an image of the needle puncturing the bowels.
And then just a few interesting facts we found. The amount of fluid collected depends on the test. It's usually a tiny sample. The first 2 milliliters are discarded to prevent contamination from maternal genetics. It can treat polyhydramnios hydramnios, which is basically excess amniotic fluid. It can detect infections in the uterus before birth, and it's 99% accurate for detecting chromosomal conditions and 1% chance of a false positive. And then our bibliography.
No, I got a question,
Alright.
of course.